Hello, welcome everybody. My name is Alec McKinney, and I'm here to help facilitate discussion for the Community Health Needs Assessment Fruit Forum here in Shrewsbury. I am part of a company called John Snow Inc., and Darrell Fox here is also a colleague of mine. And we've been hired by the Worcester Division of Public Health, as well as UMass Memorial Medical Center and Fallon Health, to conduct a community health assessment, which will then feed into those organizations' community health improvement plans. The Massachusetts Attorney General and the federal IRS require that all nonprofit hospitals and health plans conduct a comprehensive community health assessment that truly engages the community, that looks at quantitative data, and really tries to understand what are the underlying health issues in the community that are of most concern to residents and to service providers and other stakeholders. And so we collect quantitative data, we engage the community through forums like this, and with the intent of really trying to understand, well, what do people think are the driving issues? So I'm going to go through a little bit of a presentation here, just 5 or 10 minutes, and tell you a little bit more about the actual background and the nuts and bolts of our assessment. And then the bulk of this time that I want to spend with you is really hearing from you all and discussing what do you think are the leading social determinants? What do you think the underlying issues that prevent people from getting access to services or access to care? What are the housing or poverty issues that really have a bearing on people's health? As well as some of the underlying issues around diseases or conditions or risk factors that in fact impact health. So I'll help just guide some discussions as to what you think are the major issues. So I want to actually recognize, before I go any further, we have Alexis Travis here from the Health Department here in Worcester, who's on our steering committee. But it's also Karen Clark, Monica Lowell from the UMass Memorial, Nikki Nixon, Kim Reckert, Kim Salomon, and Cheryl Schmaltz. These are two representatives from each of the lead partners. And then we have a very broad-based advisory committee. And these folks are helping us to make sure that we're conducting the assessment correctly and really integrating the context here in the community. As I said, these assessments are required every 3 years, and their purpose is really to highlight community need and understand, well, what are the social and health issues that affect people, to motivate dialogue and encourage communities to talk about what's happening in their communities, to foster partnerships across the different social service, community health, public health departments, and really leverage all of the resources that are here on the community that are working towards health. So we work together to really make sure that we understand the issues and then promote collaboration. As I mentioned, we're identifying, clarifying needs, engaging residents. We are required, because through the Attorney General's office, to include the local health departments. So here, the health officer in Shrewsbury, as well as the health departments and 5 other towns, which I will get into in a second, are all required to come together and really learn about the needs in the community. We look at the demographics and the characteristics of the community by age, race, ethnicity, poverty, family sort of structure. We look at the assets and strengths that the communities bring to the table, whether it be health officers and public health programming, or primary care, hospital services, nursing homes, YMCAs, senior centers, all of the various things that communities bring to the table to support health. We also look at in a very intense way at the existing health system, and then we look at data and engage the community about the needs. So all of these factors sort of come together to help develop the health improvement plan in our assessments. We conduct these assessments in a 3-phase process. The first phase is we look at data, and the Department of Public Health in Massachusetts produces a ton of data that we're able to gather and look at a town level, as well as a region and county, and then we compare that to state averages. We also do interviews with key people in the community. We've done about 40 interviews so far. We'll probably do a handful more. We also do focus groups, community forums, and we benchmark all this information against other sources. And we're here doing community forums, and then we'll feed that into an assessment and planning process. So we're sort of at the end of phase 2. So here we have the 7 towns that are part of the assessment. Shrewsbury, of course, and then Grafton, Holden, Leicester, Millbury, West Boylston, and Worcester. And so those are the towns that are part of this assessment. I really don't want to get into too much of this now, but I thought I'd give you a little bit of context of what we've been hearing from other folks. And this is really for the region. But one of the major findings is just that the social determinants of health, things like poverty, housing, transportation, food access, these things are really often some of the underlying issues that prevent people from getting care. Really, truly, poverty and housing have come up more and more in all contexts. And it's slightly different. In places like Shrewsbury, more suburban areas, it's more people who are more house poor, as they say, where more than 30% of their income is going towards either rent or a mortgage, which really stresses their ability to look after other aspects of their health. So it may not be necessarily a lack of public housing or affordable housing, but just people who are stressed and for whatever way about paying for their housing. Again, transportation has come up a great deal, particularly in communities outside of Worcester where there's virtually no public transportation, or at least a very limited public transportation. Behavioral health has come up in a major way, mental health and substance use, depression, anxiety, alcohol, certainly opioids, but this has been a major part of our dialogue. Chronic complex conditions like diabetes, obesity, and their risk factors, nutrition, obesity, physical fitness. A lot of these issues have come up also. When we did these assessments maybe 3 to 5 years ago, everyone wanted to talk about fitness, nutrition, diabetes, heart disease. And not that those issues aren't happening now, but they've really been overshadowed a little bit by the behavioral health, the substance abuse, and mental health issues. I really don't want to put too much emphasis on this right now because I really want to hear from you. But this is just a little bit of what we're hearing. Certainly language and culture in some communities has an impact on barriers to care and prevents people from getting services or to really understand the information they're getting from their providers. Healthy aging and just the challenges that older adults face have been coming up quite a bit in our assessment so far. Isolation, depression amongst some older adults who live alone and really don't have support networks, lack of transportation, medication access, and some of the challenges around cost of providing care and cost of medications. And then just access to care issues in general, particularly for those who are uninsured or low income or who are Medicaid insured or publicly insured, and sometimes it's difficult to find providers, particularly around behavioral health. This has been a major issue around access to care. Some of the major target populations or priority populations that we've identified that are particularly challenging to are low income for sure, and some of these are overlapping. You can have low-income older adults, low-income immigrants, but low-income immigrants and non-English speakers, individuals who are really challenged by chronic or complex condition, older adults, African American, other minorities with impacts of just racism, which really really affect their ability to access care, and a lot of minority populations face disparities that are related directly to their racial sort of status, and then LGBT populations. So see, these are some of the sort of leading priority populations that we've identified and that the assessment needs to really focus on to try to perfect our understanding of those populations. So that's essentially all I want to talk about in a nutshell. I could go on and on about some of the more quantitative findings, but really I just wanted to give a sense of what we're seeing and then really hear from you all. So if it's okay, actually any questions about the assessment or approach or what we've been doing so far?
What's the timeline? So you're getting all this data. What is the timeline then, so once you've assessed?
Great question. So we started this work, I believe it was in December, really setting the stage, developing the steering committee. During that time, we've been collecting quantitative data. We did interviews in January and February, started to organize focus groups in March and April. Community forums are going to happen in May. They might, well, no, they're all scheduled in May. We'll then take a step back in May and just sort of see, well, have we engaged the people in the ways that we need to, depending on the attendance and various other factors related to that. And then we'll start to put together the report in June.
June.
Yeah. And then, I don't know, Alexis, if you have some sense of when it might be distributed.
Yeah, our goal is to distribute the report in August. Yeah. So it should be finished by August 1st.
Right. So we'll be developing a draft of the report probably by the end of June, and then we'll work through some draft, iterative editing and just making sure that it makes sense. And,
yep. Thank you.
These three institutions, the sponsors, will then take that information and start to develop what are called the community health improvement plans, which are in fact what the state and the federal government actually require. The assessment is an important step to that, but what is really required is that they say, okay, well, based on the needs assessment, what should we be doing to improve health? So, yeah. So could we just go around just really quickly and just, if you could just tell me your name and where you're from, and I guess just a quick few words as to why you're here and why why you're here. So actually, why don't we start with Darrell?
Okay, Darrell Fox. Interested in hearing some of the dialogue. Currently a Worcester resident, only a Shrewsbury resident, but been involved in public healthcare, so always interested in the intersection between public health and healthcare.
Hi, I'm Alexis Travis. I'm Chief of Community Health with the City of Worcester, and I'm here because I'm part of the CHAR steering committee.
Angelique Bouthot, Community Outreach Specialist for Planned Parenthood League of Massachusetts. Recently moved to Millbury, work in Worcester, and we are more strategically planning how to address health disparities in the communities we serve. So I'm here.
And Shrewsbury is one of the communities you serve?
Greater Worcester.
Greater Worcester, great. Do you have, by the way, do you have any clinics here in Shrewsbury or the nearby? Are they all in Worcester?
I have 5 across the state, but Worcester and Marlborough would be closest.
Yeah, great.
Hi everyone, I'm Cherry Tangri and I'm an intern with the Public Health Department at Worcester.
Great.
I am in my second year of MPH program at Northeastern University, and so I'm here because my supervisor suggested me to have an experience with the community health assessment, how it looks like, because I have read it in my course, so
Great.
kind of these things look familiar.
Are you from the area? Are you from?
Yeah, I am from Shrewsbury. I moved last year to Shrewsbury from Marlborough, so
Terrific.
It's been a year over here.
Great, welcome.
Hi, I'm Nancy Tebow, and I have been a resident of Shrewsbury for about 22 years. My children have gone through public schools here, but I work at Rainbow Child Development Center in Worcester, and that is really why I'm here. We do service all low-income children in education, and my goal and what I've been working on is health and nutrition and fitness and really outreach to the community and engagement with parents. So that is really why I'm here.
Great.
We're close by to UMass Memorial, steps away.
Great, well, thank you so much.
Hi, I'm Amelia Houghton. I just started about a month ago as the Worcester county regional public health nurse.
Ah.
So Shrewsbury is, I live here and this is one of my regions, so. So obviously, still learning and trying to get a feel for what's going on in each of the towns
Great.
that we service and help. So far, I'm familiar with Worcester and their senior center and their programs. And so
Great.
I already know a little bit of what works for them, but it'd be nice to know what's going on here.
Great.
Hi, my name is Cassandra Anderson, and I work for the City of Worcester Division of Public Health, and I live in Worcester, and I do spend a lot of time working with the Shrewsbury Public Schools in particular.
All right, terrific. Well, I'm gonna, I will kickstart discussions, but please, Darrell and Alexis, if you'd like to add to or probe, I really encourage you, as Darrell is part of JSI and our team, and Alexis being part of the steering committee. So the first question I'd just like to throw out is when one thinks about health, there are a lot of different factors that support people to look after themselves, like social determinants, proper housing, access to food, transportation, what are often called the social determinants of health. And I just was curious what you all felt, and I think if you could try to put on your Shrewsbury hat first, but then if you want to put on, if you want to talk more generally, that's fine as well. But what do you think here in Shrewsbury are some of the major social determinants? And if they're different for different groups of people, please say so. But what do you think are the leading social determinants?
Of why people are here, or why they choose to live here?
No. What are the factors that are perhaps challenge their ability to look after their health, or that lead to health, poor health status, or that hinder their access to care, that perhaps are a barrier to looking after themselves?
Income, education, mostly.
So you
And maybe culturally not understanding or willing to accept what is considered the norm and what you're supposed to do.
great.
So maybe denial or acceptance of what is there, that you're being thrown into this community and you need to behave this way, but you're from this culture and we don't behave this way.
I would say the culture.
Great. So there's a lot of stuff there. Why don't we just sort of?
Sorry.
No, that's okay. Why don't we hear from the rest, and we'll sort of try to unpack some of that. I definitely have some follow-up questions to that. But what are people? What do you think?
We have a very broad range of people from different cultures in Shrewsbury. We have a lot of folks that are in the high-tech industry, and so culture is a big deal. And extended families, because the families are coming together. So you have I think there's disparity as far as what we used to, as you were saying, what we did back home,
Right.
what we're doing here.
So let's just focus for a second on culture, because you both mentioned culture. Is it different types of ethnicities? Is it people coming from? When you think of culture, it's. I mean, if there's LGBT culture, we all, there's more of a.
Say ethnicities is
Is
what
it mostly ethnicities?
Ethnicities. I mean, so part of my job is disease surveillance, communicable disease surveillance. So you get immigrants, you get refugees in our region, and we follow up with them. And so ethnicity is a big thing. Like, how do I fit in to, there's culture shock, obviously. So how do I fit in to this community? And I don't know how to behave here, and who do I follow, and what do I conform to?
Right.
So
it's more than language, although language was probably part of it.
big part of it, yeah. And beliefs. I mean, you bring your kids here, and they have to now decide: do I continue to behave the way I've been behaving in country X, or do I want to do with what my friends do so I can have friends?
Mhm.
Acceptance, you know.
What are the major segments? I mean, we certainly have data on this that I could confirm this, but just from your perspective, I'm just curious, what are the major cultural groups that you think are particularly at risk?
Shrewsbury has a large Indian population, growing Indian population.
Several countries,
Yeah, in several, yeah,
different dialects.
absolutely.
Mhm. So Asian Indian from India or Pakistan or Bangladesh, maybe.
Middle Eastern.
Middle Eastern, yeah.
Yes, Middle Eastern. I lived in Shrewsbury Commons, which is a series of townhouses and buildings, not a few minutes from here. I think there were 20 languages spoken.
Yes.
Just in my little area.
Right.
Yeah.
There's a huge Vietnamese population,
Yeah.
Vietnamese, Burmese.
Yeah.
Mhm. What do you think the biggest impacts of that cultural challenge is? Do you think it's about access to care or navigating the system or language or what do you think how does that affect them?
Well, one thing that we're currently working on is we provide translation services, but all of our outreach and marketing materials are not in all languages. So we have this great resource that we have for our patients, but then we also need to get that information to those patients that
Right.
it is available, but we do not have materials in all languages. So then how are they finding out that that's available to them?
Right.
So not necessarily even that the care isn't there, but we don't have an effective way to talk about the availability of that care.
Yeah.
Yeah, we use, I can bring my work phone to your house and bring up an interpreter. But when I leave your house, you're on your own.
Yeah.
You know, we got you through to that point, but then what?
Yeah.
How do you get that same level of interpretation throughout whatever you need to do in your life?
Thinking outside of Worcester at this point, what resources are there to support people who are from different cultures? Are there go-to organizations or advocacy groups, or is the town hall or the public health department able to support these folks?
A lot of people go to Worcester, I mean, I would assume, and, because the buses run.
Yeah.
to Worcester.
How often do the buses run? I can find that
Yeah,
out.
I mean, but you know, you see that the buses are running and things like that, and I would think through the library, it's just redone, the library, it's really a community center.
Yeah.
That would be a spot where I would assume people go.
Yeah.
It is a welcoming, all people from all walks of life, and people really value education, and it's in the parks, the public spaces are used, as well as that public library is used very, very frequently.
Great.
By all walks of life. So I'm assuming that that's where a lot of information would be disseminated.
Great.
More so than coming to here. It would be the library. It would be a safe spot. Welcoming.
Right.
Yeah.
Increasing number of health literacy, culturally, health literacy programs that are based in libraries. So,
Yeah.
Yeah. I'm sorry, I've forgotten your name here from the health department.
Amelia.
Amelia, you mentioned poverty and people who struggle with low income status, perhaps. Do people agree that that is a major issue too for some people?
In Shrewsbury, some.
A little.
Pockets.
Some pockets.
Pockets, but not a major factor.
Not like Worcester.
All right. What about other factors, other social factors? Certainly language and culture we talked about, poverty not so much. Are there other Education was mentioned. Transportation was alluded to here a little bit. Other factors that you think are particularly problematic or have an impact for people here in Shrewsbury, and particularly I'm hoping that this forum can help us to illuminate issues outside of Worcester a little bit. So if you could just think a little bit in that frame.
Maybe understanding, like, for example, health insurance. But I guess the library or the town hall are places where people could go and get help. Schools, senior center, I mean, I don't know.
Senior center.
I don't know yet what happens in the senior center here, but I know the Worcester one has a ton of programs to help people 55 and above with taxes. They teach languages, dancing, painting, everything. Nice community center. So I don't know what happens here yet, but
It's pretty active, I mean, I give them flyers, it's pretty active.
you know,
I mean, the
there's
bus
help.
was just coming in, you know, I mean, it's food.
Who brings them here? Is it the public bus? Can bring them here,
Yeah. Or if they are,
or
if,
taxi or Uber,
Yeah,
whatever people
yeah.
use.
or if they're in a nursing home, whatever,
Their own
they have their own
transportation.
transportation.
No, go ahead, Dora.
No, you said, I didn't, in my years living here, I didn't see many taxis at all. But I know now, that was prior to like Uber and
Uber.
Lyft and everybody getting so big. But there's no sidewalks in a lot of areas around Shrewsbury,
Yes.
particularly when you're near Route 9 or Route 7. And so you could want to get to the bus stop, but you're at risk when
Yeah.
you do that. And then because we have those major thoroughfares, if you have asthma, you have a lot of traffic, you get a lot of particulate matter, all the cars coming through. So I think that impacts a lot of people as well. So when we talk about transportation, I know there's buses, but you gotta try, it's hard to get to some of the routes from some
You have,
places.
it's the main, you're
Yeah.
right, you're absolutely right, it's
Yeah.
this
And the
main.
traffic patterns are pretty bad.
Yeah, like I was bordered by Route 9 and Route 20, and so you really have to have a vehicle
Yeah,
Yeah.
to go. You can't even cross.
yes,
No,
that is very
either one
true.
of those. And there are no
Yes.
sidewalks on either side.
no sidewalks, a lot of roads in disrepair, traffic patterns are not.
Yeah.
Yeah, I would agree. If you don't have a vehicle, you really
You
can't
can't
do
get
anything
anywhere.
in this community. People don't walk to school, and the school don't want anyone to walk to school because it's too dangerous to
begin
do
with,
that,
yeah.
basically, to begin with. And even the schools are designed so that they're not walkable, interestingly. So it's definitely like you have to take a car or.
But there's no late, like Shrewsbury High, there's no late buses. So you're running from work, as I am, to get there, so they're not hanging out for 2-3 hours on their own.
There used to be late buses, there used to be extended day. If you, yeah,
I mean, these kids wanna do sports, they're not out before 5. It's
Oh,
either
I know.
5:30 or 6, sometimes 4:30. No, after whatever it is, 3, there's no bus.
Yeah.
Oh,
They can walk to the library, basically, and that's about it. And then they have to be picked up, the library closes at 5, and they have to be picked up at
You mean
5.
this public library
Yeah,
from the high school?
yeah. They walk there. I know.
Yeah.
And the middle school
No.
walks there, the
My
kids
son
walk a
did
lot.
it
It's like
once.
it's a big issue that they walk there
That's not
unattended.
safe. That's
And,
not safe.
yeah, a lot of parents don't let them because it's not very safe, but that is what a lot of young people are doing. And there's, besides the library and the senior center, there is an Indian Cultural Center, but I don't know how active it is and how many people go there for information, or if that's really something that they have there. I haven't really interacted with them. There's also Shrewsbury Youth and Family
some
Services.
cities and things.
I would say that's probably what I would, if you like asked around Shrewsbury, that's probably really the only service agency that I think is here.
It's
and
only
that
one,
people
So-
would-
there's only
Yeah,
one.
there's the only.
Senior Center, Youth and Family Services, the library, the town hall,
Faith-based organizations.
And then a lot of
Indian health,
Faith-based organizations.
faith-based organizations. I think that's, you mentioned maybe one more? Or that was it? That
Well,
was-
I would say like the cultural organizations as well as the faith-based organizations.
So cultural as in like the Indian,
Yeah.
is there others?
I'm not familiar with other ones, just that one I know it's like very visible,
Mhm.
but there could be more that I just haven't
Great.
seen.
Last thing, and then I'm going to move on to behavioral health, so just keep that in mind. What about places for recreation? Certainly sidewalks and sort of what we often call in public health these built environments that allow you to walk around in your community. That seems to be a bit of a challenge. But what about recreational facilities? And I guess I'll throw in food access for just as in the idea of food, nutrition, and healthy living, active living. So in that realm, is there ability for people to access food and to exercise and stay fit in Shrewsbury?
If you have a car. Let go the rest of it if you have a car.
I mean, you have options for food, you know, you have from Price chocolate to whatever,
Stop
Yeah.
and Shop and the newly Whole
Whole Foods and
Yeah.
Paycheck.
Are there food banks for people who are?
Shrewsbury Food Bank.
Yeah.
there
Yeah.
is,
The
yes.
food bank, yeah, very big.
Yeah.
I mean, the schools have, recreational stuff, but again, it's at school.
And they also have like reduced meal pricing.
Yeah.
Every school does that too.
Yeah.
So there's help.
Yeah, and then, they have Parks and Recs, they have summer program.
Great.
They have, the parks here, as far as just different city, Dean Park has a lot of little city baseball leagues and things like that, softball, even here at the foundation, you'll see soccer. But if you're low income, it's prohibitive, because you need discretionary funds, there is a fee,
Mhm.
that kind of thing.
Okay. All right. Well, I'm going to go through a handful of issues. Oh, sorry.
Just because I know this has come up a few times, there are pockets of poverty and low-income folks. So I'm just wondering, with respect to social determinants, how that affects people's ability to apply housing here. Is there affordable housing stock for those people who fit into those pockets? And what are people doing?
I was at a cultural meeting in the Worcester Senior Center, not to bring it back to Worcester, but one major issue that came up was, and I don't know if that would apply here, that there were not enough levels of affordable housing. Like some people, you're at this end of the scale, you can't afford anything private, and that's what you want, but you can't because of what you make or what you have. Or you're in the middle and you can't go in either direction. So it's choice is a big deal.
Yeah, I would say there's probably a low level of homeowners who accept Section 8 vouchers, I would guess. I don't know if anyone does. But just one quick other note is some of the bigger complexes, like we had tennis courts and a gym in Shrewsbury Commons. And I think there's two other, the farms and a few other places where they try to build in a place where because you can't walk anywhere. So
Right.
try
Yeah.
to save place, so we actually had a full size gym and then the tennis courts. I know two other places that have that in Shrewsbury proper.
Is there a YMCA here in Shrewsbury or a Boys and Girls Club?
There's a YMCA near
No,
BJ's, but that would be north of
Borough,
It's technically North Road's right on the line.
It's on
It's
the
the
line,
boroughs,
yeah.
so it's shared.
the boroughs, yeah.
It's on Route 20, also it's not walkable.
Mhm. But it is accessible to Shrewsbury residents.
Oh, yeah.
Any other final thoughts on social determinants and things that you think affect people's ability to care for themselves and look after their health? Going once? Going twice? Gone. Okay, great. We certainly can circle back. But at the end, I'm going to ask what you think is the priority issues across all of our topic areas. But for now, I'm just going to go through each one. As I mentioned, mental health and substance abuse have really come up as just a major issue. Certainly opioids are in the dialogue today, but there are lots of different substances, and certainly mental health is a huge burden on families, individuals, and communities. I just wanted to think a little bit about the context in Shrewsbury and just more broadly if you'd like. But what are the major mental health issues or substance abuse issues? Do you see this as a major problem in this community?
The schools, I have friends who are teachers, a lot of depression, anxiety, so, the alcohol, the drugs, and some of these kids have a lot of discretionary income. It's in the homes, and they have access to it.
So you're talking specifically about youth in this case? I mean,
Because I-
school
only
age
'cause I
school
do-
age
yeah,
kids.
school- yeah, yeah, and it's a lot of weed, a lot of, so, and again, just talking to my friends who are teachers, middle school, certainly the high school,
So for youth, depression and anxiety,
yeah, they have pressure,
stress.
a lot of stress,
Yeah.
yeah.
And then as far as substance use in youth, what do you think are the major? I mean, I know this is just your perception, but what do you think are the major issues?
There's a lot of competition, there's a lot of competition in Shrewsbury to excel.
Well, and it's easy to, like, at a younger age to get into
Yeah.
painkillers and to
And-
kick it all off because you're in sports and you get hurt. You have to go to the doctor, you get painkillers. Then all of a sudden you're taking the painkillers
Or-
from the medicine cabinet
I was gonna say, or the mom, dad.
or the mom and dad.
The mom and
have-
dad have that kind of stuff. Mom and dad have that kind of stuff.
Or grandma has painkillers.
Yeah.
And it goes around and before you know it, it's snowballed into substance abuse and then later on addiction.
Alcohol. And as far as substances are concerned, is it marijuana more significant in youth, or is it alcohol?
Again, when my kids were going through it was alcohol, but now I'm hearing it's a heck of a lot more. It's
It's
everything.
worse.
It's worse. It's worse.
It seems to start with opioids at a younger
Yeah.
age and then it escalates
Yeah.
into whatever's on the street.
Right.
All the fancy new stuff.
Okay.
Seem to know the words.
Any other thoughts, on youth or other segments of the population, as far as mental health or substance use is concerned?
Well, I think what you were saying, I would echo that Shrewsbury students are under a lot of pressure to excel, and it's an extremely competitive school environment in a very, very large school. So you have thousands of students.
You're talking about the high school.
Yeah, the high school, middle school, just
In the middle school,
and the middle school, you have thousands of students competing to be the best
Yeah.
in a community that expects everyone to be number one. So stress and anxiety are like the number one issue for students at the schools.
Depression.
And it comes out in what we see with working in the schools. They'll even say that that's like, number one for them is the
oh yeah,
behavioral health of their students
oh yeah.
and dealing with those issues. And there's only Shrewsbury Youth and Family Services, which has a very small staff to deal with all behavioral health issues, unless people want to leave and come to Worcester. So,
Or privately,
or,
private pay.
or go to private
Private
pay practice, yeah, so that,
I mean, and culturally, again, different cultures,
Yeah.
you will exceed, you will be the best, you will be, and so these kids are like, okay, now everybody's competing,
For conversations
Oh.
about trauma from some of the immigrant
Yeah.
populations here,
the parents though have put on a lot of pressure that,
Right. Yeah.
There also seems to be, so I do a lot of community outreach, and you can kind of go in the stores, and depending on how wide their the wraps, the flavored wraps are in the store, you can kind of sense that there's a lot of use of marijuana. And so you find now the gas stations in Shrewsbury, the stores, another store by another place where you find car wash. It's like a whole counter for flavored wraps. And these aren't for
Like,
adults. The things that they open up and put marijuana in, they make blunts and stuff like that. And so we used to go to parks in Boston when we do outreach, and if you see a whole bunch of tobacco on the ground, that's from them opening up the wraps or the cigars
I see.
and putting marijuana in it and smoking it. And so I was surprised that, because when you're in either Westboro or Northboro, it's dry. They don't sell tobacco products or the wraps or the cigars. But in Shrewsbury, every gas station I've
they
seen
do.
as a whole, and they have a wide variety, and that's when you kind of know that there's consumers, and that's why they're doing it. So I don't know if anybody else does that, but if we drove right now to each gas station, we would see a rack of multiple tobacco products that are really made not for tobacco smokers, but for marijuana smokers.
Interesting.
Never noticed what any of that looks like.
In the realm of mental health and substance abuse, there's really two different issues that typically come up. One is around mild and moderate issues, like depression and anxiety impacts just a huge proportion of the population. And a lot of that is either undiagnosed or untreated or and really not addressed. You also have the more, and in the case of substance use, you have a lot of folks who are using alcohol, maybe occasional weed or marijuana, and it's more of an occasional use. But then you have the more serious issues around bipolar or schizophrenia, or those with serious mental illness, or those who are really suffering from addiction. And I'm just curious, in the realm in Shrewsbury, is it more mild to moderate, or is it more severely mentally ill, or people who are more, acutely addicted? Or is it both?
Schools.
Mm-hmm.
I mean, there's a lot of parties and stuff, there's a lot, so.
So it sounds like you're thinking more about those who are mild to moderate, who are using and perhaps struggling with that use, but not necessarily in a severe category, or does that?
But the kids would know that there are some kids that are definitely severe.
Mm-hmm. So it's,
Yeah, and the schools know,
mm-hmm.
social workers know.
Yeah.
Yeah, and I think there's a small portion of folks who are addicted to some of the heavier drugs, and you can do that when you look at the police report.
Yeah.
And you notice the break-ins,
Yep.
some of these have happened, and some of the frequent flyers of that, it looks like they're trying to feed their addiction. Small crimes, the pocketbook snatch, the breaking into the car for the
Yeah.
somebody see. And I think I was surprised by it. And you see some of the same streets in the same areas all the time. So that's usually a sign that
Yeah.
people are
So you feel like there are some.
Again, pocket,
yeah, small percentage. Yeah, like literally you could probably take 3 weeks of the Shrewsbury News, look at the listing, and you will see multiple streets listed every time. And you'll even look at some of the street numbers, and you'll see that some of the same areas are. That's been my experience. Yeah, who else picks up that Shrewsbury News?
I think a lot of folks who are struggling with addiction are not folks who are going to be showing up in police logs. I think they're folks who are trying to self-medicate for other issues. They're folks who are accessing some type of treatment. Maybe it's not the right kind of treatment. Maybe it's not enough treatment. Maybe they're traveling for treatment. I think in the area we have a robust, not robust enough, but a great network of folks who are providing care for addiction. But there's issues if folks are going to detox, if folks are going into a residential setting. Is their insurance going to cover it? Is their insurance going to cover the full length of their stay? Are they
Yeah.
getting kicked out before they have finished treatment? So I think there's some other concerns, not necessarily whether folks in the community are experiencing it, but how they're experiencing care.
So you took the next question right out of my mouth. So what about the service system? It sounds, do people agree that there seems to be sort of an ample array of services, or are there shortages or gaps? What are the major, if you can think of them by name, what are the major substance use clinics? What's your sentiment? What's your feeling on access to services? Do you think people know where to go and have access to care?
I don't think that folks know where they need to go until they're in a crucial point
Yeah.
of need.
Yeah.
I don't think folks who are not in a state of need know that until they're
Hit rock
at a point where they need to access services. And then finding either the place to access that care or finding someone who can connect them. So are there strong referral partnerships between different providers? If they're seeing a mental health provider, is there a provider who can refer them to a quality addiction treatment type of program that would work for them? So it's really like, are providers communicating?
Also, if you show up through the ED, then those providers, they would set you up with social workers who would do all this outreach and help you get settled. Then you would know what's available. That's what you were saying. You don't know until you need it.
I'll just say from our interviews, one of the core, very consistent statements or thoughts was that there really was very limited access, particularly for those who were Medicaid insured or low income. And then even for people who had insurance, who had means, the benefits are not that strong, and people are often underinsured. And so it often tends to be a cash economy. And so the sort of access to people who had for affordable care, and particularly that for low income, was one of the biggest challenges.
Yeah.
I don't know if that resonates with you, but that's what we heard from our key informants. No one's talked about opioids. I mean, a little bit. It's alcohol and sort of weed. I guess we touched on opioids a little bit, but I guess throw it out. I mean, there's so much in the dialogue right now. Do you think, how much of an issue do you think opioids and OxyContin and heroin, is that, how much of an issue is that? Do people know people have overdosed here in Shrewsbury? Is it something that is part of the community dialogue?
Again, it's just from the person who's director of special ed type of thing.
Mhm.
Yeah. And there were some kids that actually, when they got into the workplace, older, ended up addicted.
Stay awake to keep their job.
Yeah, to keep their job, and also because they are so used to being kingpin, and then all of a sudden they're not, and there's a lot of stress. And my daughters, she's got with their friends, really addicted. One person here in Shrewsbury, top notch, Yale, the whole thing, opioids, passed away.
Wow. So
28. Yeah.
Great.
Again, so it's not the norm, but it really touched So that was, 7 graduated, and then we got to, yeah, it was crushing, so for the families, all the way through, line. So maybe that's an issue, I don't know.
Well, and the parties now, they, you know, at these high school and college parties too, they have these drugs that you never even heard of, and all you have to do is take it once, and you're either dead or your life is ruined. Forget even what they call the punch bowl parties, where everybody brings
Oh, yeah, that.
leftover pills from home and you don't know what you're taking, but you just grab a handful and take them. It's just incredible. The opportunities to.
And you think those types of parties happen here in Shrewsbury?
I would say there are things going on at the high school level. I would bet on it.
Yeah.
Right? I mean, maybe not younger, but
Oh, I would, yeah. I mean, we have St. John's, yeah, kids.
you know, many times you hear coaches at, you know, parent meetings. We had an incident. We just want you to know we took care of it. You know, that kind of thing. And before you know it, somebody's off the team.
All right. Let's move on to, unless anyone else has any questions or thoughts. Yeah.
I just want to say one thing. So we're looking to expand our services for trans folks, and we had focus groups essentially talking to folks about what they need in sort of central Mass. This was a conversation about access to care in central Massachusetts. And repeatedly, the concern was people didn't know how to access care unless they knew someone who was already accessing care with a provider. So they said, we want really quality mental health professionals that are not only quality mental health professionals, but are also going to be affirming of our gender or affirming of our lived experiences. And they had no way of knowing whether or not they were getting a quality provider until they were in that room.
Right.
After already going through extensive searches, and you know, maybe it's listed on someone's website that they're trans friendly, or maybe it's not listed and they are, or who's vetting that process to say that they are or not. So it was a huge challenge, and folks are often traveling very far or accessing care in ways that aren't covered. So for example, accessing care through online counseling that's not covered by insurance, but they know that they're getting quality care.
Yeah.
So they're finding other ways that are not helpful, or that are helpful but are not easy to
Accessible,
get to, affordable, or accessible to everyone.
It brought up another issue that I can imagine is a problem, but is culturally appropriate mental health and substance abuse for different types of language groups or cultural groups, and certainly the trans population is one. But I'm quite confident that given the diversity that exists here in Shrewsbury and throughout the region, that access to therapists with who speak your language or from your culture, I think, or at least understand your culture, is challenging. Does that make sense to people? Let's move on to more physical, chronic, and complex conditions and their risk factors. So one of the groups, or sort of the broader domains we'll be looking at, is things like heart disease, stroke, cancer. Those are the 3 leading conditions, the 3 leading causes of death. Certainly diabetes related to heart disease and hypertension, but it stands alone as on its own. Hypertension. The risk factor, cancer of all types, the risk factors related to these issues are all the same too. It's obesity, fitness, nutrition, tobacco use, alcohol. And so I'd like us to think a little bit about that realm of chronic and complex physical conditions, and just and see if you think those issues as a whole or individually are on your radar as far as a major issue, and if so, what elements of those? Is it more around heart disease or hypertension or some of the risk factors? I'd just be curious what you think about that realm of health issues.
Childhood diabetes is really is growing.
Mm-hmm.
Kids,
Yeah.
a lot of kids.
Heart disease, any part of heart disease is just massive.
Are there segments of the population you think that are particularly affected by?
Asians, African Americans, unfortunately, always get that end of the stick.
Mhm.
But anybody really,
Mm-hmm.
anything goes if you're in that environment and behaving that way or have that genetics. It's don't care who you are. It's
Mm-hmm.
it's coming.
But in Shrewsbury, is that a part of the sentiments and the perception, or is that a major issue for people in Shrewsbury, sort of diabetes or hypertension, heart disease, or would you prioritize that? If you were developing a community health improvement plan, would you prioritize diabetes for people in this community? Or what's the sentiment, I guess? Do you have a sense?
Yeah, I think kids and diabetes, and I also think there are a lot of adults that are definitely on the verge of heading right towards diabetes.
There's a lot of pre-diabetes.
Pre-diabetes, yeah.
And there, here, I was doing the Master of Science Nursing program in Public and Community Health, and my windshield survey was about Shrewsbury. Asthma is big
Asthma.
with kids and adults. Asthma and water cleanliness was also an issue for some reason at the time. But asthma.
It's a bit dated, but we do have data on the prevalence of hospitalization, mortality, by chronic conditions. So, and we do have that data by town. So we will be able to look a little bit more at the statistics. But I'm just sort of curious on the perception in the community related to these types of chronic conditions. Asthma, you mentioned, that seems to resonate with you. Childhood diabetes. I'm sure if you look at the rates in older adults, they're going to be, they'll be high.
Yeah.
Tobacco, do you feel tobacco is an issue here in the community? Maybe in the schools or?
I don't honestly notice it so much anymore.
Cigarette butts, you can't smoke in the complex I was at, so
Right.
outside, you can't smoke inside, but outside, a lot of cigarette butts.
Yeah. Well, we certainly we'll have tobacco rates, one of the more pretty recent tobacco rates of current or ever smoked tobacco. So we'll have all that.
I think it depends on where you go in the community.
Mm-hmm.
But I would say in most of the community, you're probably not going to see people smoking. But if you went along like Route 20, you would see a lot of smoking. So
In
it's,
pockets.
yeah, in pockets over there.
And
so,
what's the nature? What do you think is the nature of that trend or in fact?
Well, outside of restaurants, I see a lot of people smoking, like at night when it's dark and you're either inside or you're waiting. They hang around talking. That's where I see a lot of the smoking. You're just waiting, socializing. Wherever you can gather. That's where I see.
With
Yeah.
truck stops
too.
so yeah.
and
Stops.
lower income area.
You have a few trailer parks on Route 20 and the truck stops. places that you can like rent construction vehicles, there's strip clubs, and bars.
It's a lot of commercial.
So, yeah, a lot of commercial places.
It's very, I mean,
It's kind of the opposite of Route 9.
yeah,
It's like
I mean,
all the nice
yes.
fancy stores around Route 9 and all the stuff that's like the opposite of that
Yeah.
is over on Route 5.
very fine lines here as far as, you know, in Shrewsbury. You have McMansions and you have,
Yeah, you can go anywhere in the town. You
It's
can turn
very
a corner,
different.
you have a mansion and then, you know, a modest home or
Yep.
a trailer park. And it's like, you turn another corner, 2 mansions and
Yeah.
2 small
and
homes.
then there's a whole
There's a
section
lot of variety.
of mansions. I mean, there's a lot of, there's a lot of wealth, there's a lot of
Yep.
wealthy community. But that, again, I think,
So it
again, I
has the
have the
same
friends that,
problems.
yeah, they're the same problems, because there's the friends whose kids are going through school, and the pressure, I can't stress that enough, because then the parents that get involved, then they're stressed out, everybody's stressed out, and everybody's very, it's very, very hypertense.
Well, it causes tension between the parents.
Yeah.
If the child doesn't do well,
Yeah,
then their marriage is strained,
Yeah.
their relationship is strained. It has just
It just-
resounding effects
doesn't
all
it?
around.
yeah, and the MCAS,
Everything, all of it.
everything, like,
Yeah.
the kids,
Now you need all these extra tests and.
yeah, the extra test, but I mean, even like, it's kind of funny, because people in, the folks that, the kids that we service in Worcester low income, the parents don't know when MCAS is really happening, or
The
really.
kids refuse to.
So the kids don't, and the kids don't, like, yeah, okay, and so, but in Shrewsbury, it's, oh my God, it's MCAS
Yeah.
week.
Right.
Everybody knows.
Everybody know, you know.
Which is
So this-
supposed to be, it's assessment for teachers, not so much for
It's,
students.
well, I mean, you know, I'm just saying that, you
Really?
know.
You could have fooled me.
Yeah, no, I mean, teaching to the test, the whole shebang, so I mean, certainly it is important in Worcester, but the population that we are servicing, the parents don't even, many weren't aware.
I'm sure when, the day when those MCAS reports
It
come
was-
back to
no,
families.
no, yeah. Because we're really still working on food, clothing, and shelter, you know, it's with different priorities.
Well, the last issue I want to talk about, we've talked about children, and when I talked to the town manager here in Shrewsbury, he said really the priority population, as far as I'm concerned, is older adults.
Yeah.
And I'm just curious whether that resonates with you in Shrewsbury. He says, generally it's a relatively healthy and affluent community. It sounds like that's not entirely true, or at least there's some debunking of that. But he said really it's older adults. It's really the more challenging priority population. Just curious if you think that's true, and if you have any thoughts on that, on what you think some of the major issues are for older adults.
Well, from my experience so far, I go to the Worcester Senior Center twice a week, and I do blood pressures there, and I try to meet up with some of the groups with interpreters, but they're, and they have a lot of health issues, but for them it's understanding, it's that cultural barrier, knowing where to get what you need, and how do you go and get it if you don't speak English. So education, how are you educated? How are you prepared for what you need? That sort of thing. But housing, for Worcester, I don't know that it applies here, but housing and income are 2 big issues for them.
So
And cultural barriers.
fixed incomes and just challenges around.
Not enough options for
Mhm.
certain parts of their lives. They're kind of just stuck somewhere, and
Any other thoughts on older adults and what some of the major risk factors are? What are the biggest
I'm
challenges?
trying to think if there's a lot of people who want to stay in their homes, and now it gets to be unsafe. I have a feeling that that's what it is.
Mhm.
And there's a lot of Band-Aids, because the children have gone out, and they're in different parts of the country, and then I have friends who are doctors and nurses, whatever, like, oh my God, 'cause then when it's holidays, they see what mom and dad really are doing or not doing.
Yeah.
So there's an influx. So I have a feeling there might be a significant population of older adults who want to stay in their home.
So, but struggle with their,
Struggle,
with the
Everything.
supports,
Whether they have a
income,
caregiver or not.
getting access to services, being able to afford it.
admitting,
Because to give all that up,
Yeah.
if you're from a particular culture,
yeah,
that's even worse than being alone.
yeah.
And I think that's something we agree with too. We see a lot of cases of older adults in their homes who maybe have issues with hoarding, maybe have some kind of mental health condition which is undiagnosed, and then it's a difficulty of, respecting their independence and their privacy and their will, but also providing protection and services that they need as they continue to age and sometimes deteriorate. So there's a fine balance there, and that's something that we see more and more in terms of some of our environmental health calls that we get, and the response that we need to provide, and whether it's really environmental health or whether it's social services that they need to support them during that phase.
Sometimes it's a mix of both, and hoarding is big, and hygiene is another big one.
Hygiene.
Not knowing, or being left alone, and all of a sudden you don't know how to take care of yourself. That leads to issues.
Yeah, I think a lot of it stems from isolation.
Depression.
There's a lot of people who are alone in their houses and.
They show up at the senior center, and then they have to figure out how to deal with that. So, well, I will be figuring out how to do that. And I have no idea how to wrap my head around that.
Do you think there are people who are not accessing, the level of isolation? That's a topic that comes up a lot. And the senior centers can often do a very good job at serving those people who are coming to them, but there's a whole lot of people out there in the community who are not being attended to. And it sounds like that resonates with you.
Well, if someone, unless your neighbor calls and says, my
Yeah.
neighbor, there's a smell coming from my
Or
neighbor's
watch,
house,
yeah.
please
Yeah.
come and check it out, then, health inspector, home inspector will go, might grab a public health nurse to go with them, may not, depending on what they think. And then you know that exists. So.
Okay, so are there other issues other than the ones we've talked about today that you think you'd like to mention as priority issues that you think really rise to the top, or that we, that are affecting the community?
Sorry, I have to leave.
Yeah.
Okay.
I'm just assuming the LGBT population, I'm just assuming that is something that is, I think it's the last horizon. We really got to work on that. It's not a huge population, but the population is important. It's important that, educators, and faith-based organizations, everyone has a better understanding
Yep.
of what that is, and to help these kids. And I will say, again, when they're in school age, help these kids do what they access and have their day be pleasant and have the respect. So I know that there are many, professional development days that's what teachers are now trying to, are working on.
Yeah.
It's not perfect, but certainly there's a lot more visibility. Okay, when you see it, what are we going to do? How are we going to? So again, it's the respect and the words to use.
Right.
There is a lot more acceptance now, because even in the high schools, they've
Yeah.
created bathrooms that are
Yeah.
either for male or female. And, my son comes home and he says, Mom, you can't assume my gender anymore. And he's not trying to be funny, that's what's happening. So there's a lot of acceptance
Yeah.
changing.
Before you go, I just want to, and we can continue discussions, but I'm going to try to do a quick poll. Now, we sometimes do this in a high-tech way, but I'm going to try to do a low-tech. So I'm going to go through mental health, substance use, sort of chronic conditions. What is going on with my phone? I really apologize. Who's texting me? It's my wife.
Did you find Shrewsbury?
I want, you get to vote twice. And I want to sort of identify in the realm of mental health, substance use, chronic and complex conditions. So those three, well, let's add social determinants of health. Well, let's do social determinants separately. So it'll take two minutes. Let's just raise your hand once. What do you think is the priority health issue, the highest priority issue for Shrewsbury in the area of chronic and complex conditions, mental health, and substance use? So raise your hand if you think, and you can think about it for a second if you want, but raise your hand if you think substance use is the leading issue.
I think, yeah, for young people.
Okay, so for young people, how many people think mental health is the biggest issue?
It's a biggie.
How many people think more chronic and complex conditions, diabetes, risk factors related to sort of more physical chronic conditions?
I think that's big too, because of what we discussed with the roads and the transportation.
Okay, so would you make that first, just out of curiosity, or is that?
Yep.
So it
That
sounds like
and mental health to me are neck and neck.
Yeah,
Okay.
they're all important.
Really.
They're all important. But it sounds like mental health you'd
Mental health
prioritize
is a
slightly.
big one.
What about social determinants? And I know we talked a fair amount about cultural competence and health literacy and all that, so maybe that's really the highest priority in this community. But I'm just curious, with respect to housing, cultural competence, and including language, poverty, transportation, food access. So those are sort of the five biggies.
Employment too, because if you're not getting paid what you're worth, and there could be so many issues with employment. If you don't have enough education to climb the ladder. So I think that and education might even go hand in hand.
So education, employment, vote for education, employment. How many people think housing? How many people think just poverty in general? How many people think cultural competence and language access?
It's kind
Okay. All right.
I might have missed it about the built environment. I think the issues around transportation is big.
Yeah.
For folks, people depend on folks for rides.
Did you say for older adults or just in general?
I think
In general.
In general, because of the lack of sidewalks and safety. I don't know how the kids walk from the library to high schools. I think about the distance.
Yeah.
So that's a big issue. We talk about it all the time. Our small group of Shrewsbury gatherings. So.
I really appreciate you all taking the time tonight. I can't tell you, particularly given it's a small group, it tends to be much more intense conversations. So I really appreciate you all being here and sharing your thoughts and participating. Any last comments before we go?
Fix it.
Well,
All of it.
we will be, we are writing a report, and identifying sort of what we see as the priorities. That's one of our main charges, is to really think about what are the priorities for the communities. We'll also be highlighting what people think some of the emerging strategies are. Now, I know we didn't cover that a whole lot today, but we're also cataloging what do people want to do about it. And then we'll be handing that over, writing it up, and creating some summary documents, and then handing it back to our partners who will be developing the strategic plan. Community engagement is so crucial, and frankly, it's what the state really, if you ask them what this assessment is really about, it's about engaging the community. And so I really, truly appreciate your comments tonight. So.
Thank you. Thank you.